Now, many people think it's been eradicated, but Hansen's disease, more commonly known as leprosy, has disabled millions of people worldwide. And over 100,000 new cases globally are still reported every year. Today is World Leprosy Day. Here's a look at what's being done to finally wipe out this terrible, potentially disfiguring condition.
Humanity has lived with leprosy for millennia. Though throughout most of history, contracting it meant a long, debilitating death sentence, the crippling disease has been treatable for around 80 years now. The symptoms generally first appear on the skin and mucous membranes, where the condition causes characteristic lesions. If the illness advances untreated, it can lead to deformities. It's caused by rod-shaped bacteria that are closely related to the ones that cause tuberculosis. In fact, being vaccinated against TB provides partial protection against contracting leprosy. Like other bacterial infections, it can be treated with antibiotics. A multi-drug therapy of 3 different medications cures it in individuals, but the disease remains endemic in some countries. Though the disease has grown rare in Europe and the Middle East, around 20,000 people every year still contract it in both the Americas, most in Brazil, and Africa. But the lion's share of new cases now occur in Southeast Asia, particularly in India.
Most of the new infections that we now see globally are largely from 3 countries, Brazil, India, and Indonesia. What happens is that leprosy is always clustered in certain communities or certain vulnerable groups or even certain geographic groups. These are very remotely located populations in remote geographies and so on, who have less access to treatment, etc. So it's in those milieux that the infection continues to thrive.
Although the bacteria that cause leprosy aren't really highly infectious, untreated people can spread it, and crowded living conditions increase the risk. In some places, patients have difficulty accessing the antibiotics, even though they're provided for free by the World Health Organization. And the stigma associated with the disease means many seek to hide their condition for as long as possible. Those factors and others continue to make it difficult to wipe out leprosy completely.
For more on this, let's bring in Rajiv Dasgupta from the Center of Social Medicine at Jawaharlal Nehru University in Delhi. Rajiv, why is leprosy still affecting so many people, especially in India?
Hello and good afternoon. Yes, India does continue to contribute to the lion's share of new leprosy cases, both across the world as well as in WHO's Southeast Asia region. Now, to understand it very quickly, there are 2 perhaps proximate reasons. One, that while elimination levels may have been achieved, but this does not mean that disease has come to a zero. Disease will continue to happen. But as India has embarked on active surveillance of leprosy cases, so new cases are being identified and notified, and that's what seems to be raising the figures in the recent years.
So what's causing the numbers to increase exactly?
Leprosy is a disease with an extremely long incubation period. In fact, it's termed as an enigmatic disease by some scholars. So while elimination may have been achieved, in other words, the level of new infections or persistent infections may have dramatically fallen. And in fact, India did witness a spectacular decline between early 1990s and roughly up to 2005, 2007. New cases will still continue to emerge as surveillance is maintained. There are 2 quick aspects to understand. One, as elimination was officially achieved, some of the very strong inputs that went into the leprosy elimination program were withdrawn, and as some argue, withdrawn rather prematurely. But the other issue of concern is, at least in half a dozen states, leprosy in childhood, that's pediatric leprosy, ranging anything between 10 to 20% of the cases currently diagnosed. And these are aspects of concern.
what can be done to protect people against leprosy?
Well, as leprosy specialists around the country argue, and this is particularly true for the leprosy endemic areas in nearly half a dozen states, where where vulnerable populations are extremely poor, often located in remote geographies. The program needs to be sort of strengthened back to previous levels, because as the elimination was achieved, it was horizontalized into the general health services, and some of the skills and inputs that went into earlier are now missing in a sense.
Okay, Rajiv Dasgupta in Delhi. Thank you.
Thank you.